Hello everyone. Welcome back to our channel, where we bring you fascinating insights into health and well-being. Today, we're tackling a topic that has recently been making waves in the medical community. Did you know that the risk of rehospitalization in younger women after a heart attack is nearly double that of men? It's a startling fact that demands our attention. So, in this video, we'll explore the reasons behind this alarming trend and shed light on the implications it has for women's health. Let's jump right in. According to a research funded by the National Institutes of Health, women 55 years of age and younger have nearly double the chance of being readmitted to the hospital in the first year following a heart attack compared to males of the same age. The gap was probably caused by higher incidence of risk factors among women, such as obesity, heart failure, and depression. The results point to the need for more thorough health monitoring of the 40,000 American women between the ages of 18 and 55 who suffer heart attacks after leaving the hospital, as well as a better understanding of the causes of the various outcomes. The study was released today in the Journal of the American College of Cardiology and was supported by the National Heart, Lung, and Blood Institute, NHLBI, a division of the NIH. We have demonstrated for the first time that non-cardiac variables, such as depression and poor income, are associated with rehospitalizations following heart attacks in women aged 55 and younger. According to corresponding author Harlan M. Krumholz, MD, a cardiologist and professor of medicine at the Yale School of Medicine in New Haven, Connecticut, they appear more common in women than men and are associated with more adverse outcomes. He also serves as the Center for Outcomes Research and Evaluations, CORE, director. The study reveals a need for paying greater attention to these non-cardiac risk factors in younger women in order to help design better clinical interventions and improve outcomes after discharge for a heart attack. Further research into these risk factors could allow medical professionals and their patients to concentrate on ways to help a woman's health after discharge from the hospital. Stated Yuan Liu, Doctor of Science, the study's lead researcher, a core researcher, and an assistant professor at Yale School of Medicine. For some time now, researchers have known that women 55 years of age and younger had almost double the chance of dying from a heart attack while hospitalized as males of the same age. However, it was not obvious if women also had a greater risk of cardiovascular and non-cardiovascular issues a year after being discharged from the hospital after receiving treatment for a heart attack. To learn more, researchers examined data from the NHLBI's Virgo, Variation in Recovery, Role of Gender on Outcomes of Young AMI Patients, project, which examines a wide variety of risk variables associated with outcomes among women and men who have experienced heart attacks. The study comprised 2,979 patients from 103 hospitals in the United States, 2,007 women and 972 males. The participants came from a variety of racial and cultural groups and had an average age of 48. The data revealed that over 30% of these individuals were readmitted to the hospital within a year of their initial discharge from the hospital after a heart attack. The majority of those follow-up visits peaked in the first month after a patient was discharged, then gradually decreased in the months that followed. Researchers discovered that women were 1.65 times more likely than males to require rehospitalization. The most common reason for rehospitalization for both men and women was coronary-related problems, which include heart attacks and angina that are brought on by blood vessel obstruction. Despite this, women experienced coronary-related problems at a rate that was about 1.5 times greater than that of males, in large part due to risk factors including diabetes and obesity. Non-cardiac rehospitalizations, which were 2.10 times more common in women than in males, revealed the greatest sex inequalities. These hospitalizations were brought on by conditions unrelated to heart disease or stroke, such pneumonia, hemorrhage, depression, or gastrointestinal issues. The causes of these increased non-cardiac rates are unknown. However, the researchers discovered that women were more likely than males to identify as having a poor income, 48% versus 31%, and to have experienced depression more frequently, 49% versus 24%. Although low income is not a medical indicator, it is frequently linked to bad health because of insufficient access to healthcare. Due in part to undertreatment of the illness in women, the risk for depression is known to rise after a heart attack and may be a risk factor in greater hospitalization rates. However, further research will be required to fully understand how these characteristics affect different heart attack hospitalizations. Future research on non-cardiac risk factors following heart attack hospital discharge could lead to the development of targeted strategies that can close this equity gap. Said Gina S. Way, MD, MPH, the Senior Scientific Advisor for Women's Health at the NHLBI and Assistant Director of the Division of Cardiovascular Sciences, made the statement. We anticipate additional research in this area. That concludes our video on the risk of rehospitalization in younger women after a heart attack. It's vital that we spread awareness about this important issue. If you found this video informative, don't forget to give it a thumbs up and share it with others who may benefit from this knowledge. Thank you for watching and being a part of our community. We appreciate your support and engagement. If you haven't already, make sure to subscribe to our channel for more insightful content on health-related topics. Remember, your health is important. Stay proactive, stay informed, and take care of yourself. Together, we can make a positive impact on the well-being of women everywhere. Take care, and see you in the next video.